Hello, we are Team 1 and we're going to present on Tufts Medical closing their 41-bed pediatric unit. With Tufts closing their inpatient pediatric unit, there are a few implications for this decision. In the past, kids would have an overnight stay at Tufts Children's Hospital. With this closure, any hospitalization will now take place at Boston's Children's Hospital. Within this pediatric unit, there were 140 doctors and 100 nurses. Since the unit is being refurbished to an adult ICU, these staff members, who are specialized to work with children, would need to find another employer to continue to utilize their skills. Otherwise, if they decide to stay with Tufts Medical, then they would need to take on a slightly different role, either within the new adult ICU unit or somewhere else within Tufts. For example, maybe one of the pediatric subspecialties that continues to provide outpatient services for these children. Unfortunately, although Tufts will keep their pediatric subspecialties and a few of their pediatric outpatient clinics, there is a high likelihood that these pediatric clinics could lose patients due to the fact that there isn't an inpatient ward on the off chance that a patient does need to stay the night. Any child that does have an outpatient same-day surgery that ends up needing to be hospitalized will need to be transferred to Boston's Children's Hospital. The two biggest problems Tufts was facing were the finances and the population needs. For the finances, more than 60% of the patients at Tufts Children's Hospital are enrolled in Medicaid, where the state controls the reimbursement level, which oftentimes can be much lower than the reimbursement from private insurance. A large share of the expenditures was out of pocket for these children's healthcare services. Many of these out-of-pocket bills could not be paid by families, so they were going unpaid, which led to losses for the hospital and the healthcare system. In all, Tufts was not generating the revenue needed to keep this unit afloat. In addition, the surrounding population needs were not being met. Tufts was having to turn away adult patients that were needing specialized medical care because they did not have enough beds to fit the demand of this adult population. For the pediatric population, it was projected that there would be a decrease in the need for hospitalization. But if there was a hospitalization need for a child, it would probably be for an acute level medical issue that would need highly advanced care that Tufts wasn't able to provide currently. These patients would have better care at a more advanced facility that would be better to suit their needs anyways.
Some gaps and weaknesses that came from this decision are decreased competition. And we know that when you decrease the competition, it can result in increased cost for both the insurers and the patients. Also, Boston Children's has a reputation for being selective in which insurances they take on, which can lead to gaps in coverage for these patients. The decision was announced in January to close Tufts Children, and even though it wasn't being implemented until July, that decision caused many of the staff to leave Tufts, which created a staffing shortage in the Children's Hospital prior to it ever even closing. And then lastly, how to handle the ambulatory services and how to best support Tufts Medicine's pediatric community. It's a hospital network and it's a thriving network of over 70,000 pediatric patients. And so how to effectively coordinate that care across the region. The decision to close Tufts Children's Hospital was created in response to an observed shift in the healthcare needs of the community. With adult beds in high demand, the medical center was often forced to turn away hundreds of critically ill adults every month, and at times, the center's pediatric beds were half empty. So, the number of adult patients that were in need of the highly specialized medical care that Tufts Medical Center offered had risen dramatically. And they believed that this decision was the best one to serve the long-term health needs and the well-being of the patients, the families, the employees of their community. It had a goal to increase its adult ICU and medical surgical bed capacity by 20% to be able to care for critically ill adults. They thought this expanded the access to high quality in the care in a way that also addressed their need to lower the overall cost of healthcare. Tufts Medical Center has proven that it manages adult care at a lower cost. And pediatric population is much less lucrative than the adult population for healthcare providers. Per capita, the spending on children was lower than the per capita spending on the total population. And Tufts is one of the nation's highest ranked academic and medical centers from a quality and outcome perspective. And they felt these were all the reasons that led to the decision to close the Children's Hospital and use those beds for adult care.
Tufts has been surrounded by competition for a long time for pediatric care. 3 hospitals we will talk about today include Boston Children's Hospital, Massachusetts General Hospital for Children, and Shriners Hospital for Children, all of which remain active today and, like Tufts, reside in Boston. Tufts Let's first take a look at Boston Children's Hospital. It has been ranked the #1 pediatric hospital in the nation this year by the U.S. News and World Report, as well as several years in the past. It is home to the largest pediatric hospital in the world, which makes it a huge contender for pediatric care. This hospital receives the most funding from National Institutes of Health, and it is also the primary teaching hospital for Harvard Medical School. Adding this to the fact that it is a nonprofit where research and education are also 2 focuses at this hospital. Boston Children's is very large, where it has over 40 clinical departments, 258 specialty clinical programs, 415 patient beds, and even with these statistics, they are expanding as I speak. As mentioned earlier, Boston Children's Hospital is world-renowned, and it is a huge contender for pediatric care, of which thousands of people seek out. They only care for children from the ages of 0 to 21. They have been around a long time, over 150 years in fact, and they serve the world. Patients from over 160 countries have gotten medical treatment at this facility, only to likely expand care to more countries in the coming years. What is unique about Boston Children's is that they partner with Walt Disney to enhance children's experience coming to receive care to help ease the difficulties that children often face during their stay at Boston Children's. To add to this, there is a level of burden taken off the families that are offered a place to stay on campus while their family member is receiving care. Overall, Boston covers a lot of grounds, not only geographically for patients around the world, but also for the types of services they offer. Let's first
Another competitor is Mass General Hospital for Children. This is a general pediatric facility with 100 pediatric beds. It's affiliated with Harvard Medical School and was its original teaching hospital. It provides comprehensive care to children and has done that since 1821. So it's a very established pediatric unit or hospital. And they have the only proton beam facility in New England, and that provides groundbreaking therapy for children with cancerous brain tumors, eye tumors, and other illnesses. And they provide care for 170,000 annually, including primary care and specialty visits, and they have a high degree of commitment to the market and community.
The third medical facility that we found for competition was Shriners Children's Hospital in Boston, which is located downtown, only 1.5 miles north of Tufts Children's Hospital. Shriners is a 30-bed acute pediatric specialty hospital, research and teaching center. They have a medical and research partnership with Massachusetts General Hospital. Shriners treats severe burn injuries, complex skin conditions, reconstructive and plastic surgery needs, and cleft lip and palate. They are the only exclusively pediatric burn center in New England, verified by the American Burn Association. All Medicare care costs, along with travel and housing for family, have always been provided by the Shriners Hospital Children's System Endowment, regardless of the family's ability to pay or insurance status. This Boston location is part of Shriners Hospitals for Children Health System, which consists of 22 nonprofit pediatric medical facilities located across North America.